I'm pleased to have an opportunity for us to talk. I want my health power audience to know that you are assistant clinical professor and director of professional development at the University of North Carolina Gillings School of Global Public Health. So we're delighted to have you with that kind of expertise to talk about narcolepsy today.
Well, thank you so much for having me. I appreciate the opportunity.
Right. Now, can you tell us what narcolepsy is?
Sure. Narcolepsy.
Let me say one thing before I meant to mention that you yourself have narcolepsy, and that's one reason you're interested in sharing your experience about narcolepsy with others.
Yeah.
I guess another thing I might mention is that narcolepsy has a lot to do with sleeping or sleeping disorders or sleeping experiences, and you can tell us about that.
Yeah.
And the fact that for more than 20 years you were not diagnosed with narcolepsy, although you had it, and that your diagnosis was actually made when you were 36 years of age.
Yep, that's correct. So I do have narcolepsy, and that is the main reason I am passionate about raising awareness of the symptoms of narcolepsy. It did take me 26 years to reach a diagnosis. My symptoms started when I was 9. So narcolepsy, it is a type of sleep disorder. It's actually a chronic and sometimes debilitating neurologic disorder of the sleep-wake cycle. So the brain's ability to control the sleep-wake cycle is impaired. So you have aspects of sleep and wakefulness that are occurring at inappropriate times throughout the day. So like I said, my symptoms started when I was 9. I just stopped waking up in the morning. I'd been a really energetic little kid, loved to get up in the morning and go to school. But suddenly I was just extremely sleepy all the time, sort of this all-consuming sleepiness. Couldn't make it more than a couple of hours without needing a nap. Had a lot of trouble concentrating, paying attention, just very, very sleepy during the day. So that was the first symptom that I developed, and then there are 5 main symptoms of narcolepsy, and you don't have to have all 5. You could just have 1 or 2, but I gradually over time developed all 5.
Can you quickly tell us what those symptoms are?
Sure. Another main symptom of narcolepsy, and you can have narcolepsy without this, but it is called cataplexy. And that is a weakening of the muscles that sometimes occurs with strong emotions like laughter or surprise or anger. So for me, my cataplexy is very mild. So if you saw me having cataplexy, you might not even notice, or you might just think I was really clumsy. I used to drop things all the time, especially like if I was cooking in the kitchen. My knees might buckle or give way just really quickly. I wouldn't fall down. But for some people who do have more severe cataplexy, they can have a partial or total body collapse where they are, their muscles are paralyzed, but they're fully conscious, so they can hear what's going on around them. They're very aware, but they can't move. It's sort of like they're trapped inside their body. And then the other symptoms of narcolepsy, hypnagogic hallucinations. These are vivid, lifelike, often terrifying dreams. You might feel a presence in the room or feel like you're being chased or attacked, but they're very real and lifelike. They sometimes occur with another symptom of narcolepsy, which is called sleep paralysis. So this is as you're falling asleep or you're waking up, you're not able to move, you can hear what's going on around you, but you can't call out for help, you can't move, and you might have a sense of not being able to breathe. And then finally, a symptom which I think a lot of people aren't aware of with narcolepsy is you have disrupted nighttime sleep, so you don't sleep well at night. And I think a lot of people think people with narcolepsy can just sleep anytime, anywhere, but it is a 24-hour sleep-wake disorder. So you're waking up a lot throughout the night. You have fragmented sleep, and then you're very sleepy during the day.
I see. Okay. How common is narcolepsy?
About 1 in 2,000 people in the United States has narcolepsy, so about 200,000 people, and an estimated 3 million people worldwide. But there are a lot of stereotypes around narcolepsy that make it really hard to recognize and diagnose. So it's actually estimated that more than 50% of people who are currently living with narcolepsy probably don't know that they have it.
I see. So that's interesting. How does the diagnosis get made then?
Yeah, like I said, it's actually really difficult to diagnose. In my case, it took 26 years, and there were several misdiagnoses along the way, things like ADHD or vitamin deficiency, checking me for thyroid problems or depression. But
is it similar? One question, not to cut across you, sorry about that. Is it similar to convulsions?
No, not really. I mean, narcolepsy can be confused with many other disorders, but I think the important thing to say is that if anybody out there is experiencing any of the symptoms that I've just described, even just 1 or 2 of the symptoms, that maybe they want to look into narcolepsy and educate themselves. There's a website called morethantired.com.
Just 1 second. Let's be sure we get that.
Yeah.
More Than Tired.
Yep, morethantired.com, sponsored by Jazz Pharmaceuticals. It has a symptom screener, so you can actually go through all the symptoms of narcolepsy and see how those apply to you. And then there's also a directory of sleep specialists. So if you do feel like you're having those symptoms, you can find a specialist in your area.
That's also on the same website?
That's right.
Right, okay, that's good to know. Let's see, what else do I want to ask you about? You said it took you 26 years to make the diagnosis.
Yeah.
Was it made just as a result of the symptoms getting worse and worse?
Yeah, I mean, my symptoms did progress over time. They started with the sleepiness when I was 9, and then they progressed over the years and sort of becoming an adult and taking on the responsibilities of adulthood and, college and a professional life. I think my symptoms just became tougher to manage, and, I was pretty persistent. I just kept going back to the doctor, and finally, I had a great primary care provider who said, maybe we should send you for a sleep study. And we did that, and I had a follow-up appointment with a neurologist, and that's when I was diagnosed.
So we can call narcolepsy then a sleep disorder?
Yes.
Okay, that's helpful to know. And I gather the diagnosis is most likely to be made by a neurologist?
A sleep specialist or a neurologist.
Sleep specialist.
Yep.
Okay.
And again, on the website, morethantired.com, there is a directory of sleep specialists there.
Okay, that's good to know. Okay, so it was very good talking to you and learning more about narcolepsy so that we could share. I will ask you one other question. Sure. So that we could share that with my Health Power audience. Is there any difference in terms of race or ethnicity and the incidence of narcolepsy?
There's not any difference that I personally know of. Symptoms usually start between the ages of 10 and 20. But again, it can take up to 10 years to diagnose. So I think, the important thing is just if if any of these symptoms sound familiar to you, if you think you're experiencing any of these symptoms, just educate yourself about narcolepsy and be persistent about getting a diagnosis.
Okay, all right. Well, thank you very much for sharing this information with me so that I can share it with, so that we together can share it with the Health Power audience.
Well, thank you so much. I really appreciate the opportunity to raise awareness about narcolepsy.
Okay. Have a good day.
You too.